Hello friends, I'm Dr. Aditya Borawake and I'm working as a consultant gastroenterologist and hepatologist at Manipal Hospital Kharadi, Pune. Today I'm going to speak about a very important and very common problem that we face in our day-to-day practice, that is GERD, Gastroesophageal Reflux Disease, or what we call it as GERD. So what is GERD? There is a valve between our esophagus and stomach, that is lower esophageal sphincter. Due to various reasons, this valve gets loosened, and because of that, the gastric contents, that is the contents in the stomach, especially acid, comes back into the esophagus, because of which the patients have different symptoms. So what are the symptoms associated with GERD? First and the most important symptom is chronic heartburn, that is burning sensation in your chest area. Patients have this for many months, many weeks together. Another important symptom associated with GERD is regurgitation, that is the patient feels that whatever food we are taking, it is coming back into the esophagus and into the mouth. The other symptoms of GERD are increased salivation, what we call it as water brash. It can also cause chest pain. Other extraesophageal manifestations of GERD are, it can cause inflammation of your vocal cords, what we call it as laryngitis, because of which there is a change in the voice. It can also cause chest pain and many other symptoms. So whenever you have any of these symptoms, the most important thing is you have to consult your gastroenterologist. Don't neglect these symptoms. That is most important. Because if this condition remains untreated for a prolonged period of time, it can lead to various complications like esophagitis, that is inflammation of the mucosa in the esophagus. It can also lead to esophageal stricture, that is there is narrowing of your esophagus, because of which patients again have problem in taking food and water inside. If left untreated, it can also cause Barrett's esophagus. So it's a pre-malignant or pre-cancerous stage. And last but not the least, it can also cause esophageal cancers. So how to diagnose this condition? The most important investigations which is required to diagnose this condition is upper GI endoscopy, or what we call it as gastroscopy. By doing gastroscopy, we can see various things like if the patient is having any inflammation in his esophageal lining, that is esophagitis, or any gastritis, hiatus hernia, etc. So this is the most important investigation. Other investigations which are also required are esophageal manometry and esophageal pH monitoring. Now coming to the treatment of this disease, there are medical and surgical treatments of GERD. But more importantly, what I would like to emphasize is the simple measures that we can take at home to prevent this condition. First and the most important thing is weight loss. Obesity, especially the central obesity, is one of the very important factors which is associated with GERD. So weight loss is very important. Regular exercise is important. Another important thing is we have to take the meals at regular intervals of time, and especially the evening meal or dinner, it has to be taken early. That is, the patient or the person should be awake for at least 2 to 3 hours after his dinner. We should avoid oily and spicy foods. Another very important thing is, whenever we have any of these symptoms, we have to consult a gastroenterologist at the earliest so that we can diagnose this condition and treat it as early as possible. Thank you.